I always talk about people being larger than life, but we don't usually think about their health being so fragile. These articles you sent me about Pope Francis being in the hospital, it really makes you think about that.
Yeah, for sure. It's like even the most powerful people are still just human.
And he's 88 years old with double pneumonia. That's not just like a little cold.
Oh, definitely not. Double pneumonia at that age it's really serious. It means that like both of his lungs are infected, so breathing's really hard for him.
And to make things worse, they said he also has a low platelet count.
Yeah, that's another big concern because platelets help your blood squat. So if his count is low, he's at a higher risk of bleeding internally, which is especially dangerous if he needs surgery or anything like that.
Oh, wow. So even basic treatments could be risky. It's no wonder that the doctors are calling this whole thing critical but stable. What does that even mean in a case like this?
Well, critical means that they're really watching his vital signs because his condition could get worse fast, and stable means that for the time being they're able to keep things under control. But it's a very delicate situation.
The articles mentioned that he needed high-flow oxygen and blood transfusions.
Yeah, that's pretty intense. The high flow oxygen means that his lungs are having a hard time getting enough oxygen on their own, and the blood transfusions are, well, they're to help with the low platelet count to try to stop any bleeding problems.
It just sounds really scary, especially because they said he had part of his lung removed a while ago.
Yeah, that definitely makes things more complicated. I mean, he's only got one full lung, so his body's already working harder just to breathe normally. So something like this, an infection, makes it even harder for him to recover.
It's like he's fighting on multiple fronts, plus on top of all of that, there's the risk of sepsis. That could be really bad, right?
Sepsis it's a huge concern whenever someone has a serious infection, especially older patients. It's when the body's own immune system kind of go haywire. It causes inflammation all over the body, which can really damage your organs.
So it's not just the infection itself that's the problem, it's how his body's reacting to it.
Exactly. And because of his age and his other health problems, the risk of him developing sepsis is a lot higher. Catching it early and treating it aggressively is super important.
And then there's this term that the doctors use. They said his prognosis is reserved. What does that actually mean?
Well, a lot of times doctors use reserved when they're not really sure what's going to happen. I mean, it doesn't mean that they've given up hope, but they're being realistic given his age and how serious this infection is and his medical history. Things could go either way.
So reserved is kind of like a warning,
It's definitely a cautious way of putting it.
like be prepared, this might not end well.
Yeah, it's a way of managing expectations without without completely losing hope.
We've talked a lot about the medical side of this, but I think we should start talking about what this means for everyone else. This isn't just some random guy. This is the Pope.
Right. He's the leader of over 1 billion Catholics around the world, and he's influential in a lot of areas, not just religious ones.
His health could set off a whole chain reaction that could change the Catholic Church forever.
Exactly. What happens next at the Vatican really depends on what happens with his health.
This is a big deal,
Yeah.
a really big deal. I mean, can you imagine the Catholic Church without Pope Francis? But these articles you sent, it seems like that could really happen.
Yeah, it's definitely a possibility. They keep mentioning this papal conclave thing, like if his health doesn't get better, they might have to elect a new pope.
For people who don't really know how all that works, can you explain what a conclave is?
Oh, yeah, it's actually really interesting. It's this whole process full of tradition and secrecy. Basically, all the cardinals, they're like the top leaders in the church. They all get together at the Vatican and they vote until they get a two-thirds majority to pick the new pope.
How long does all that usually take?
It really depends. Some have taken just a few days, others have gone on for months. But in this case, with the pope being so sick, it might happen a lot faster.
I bet people are already trying to figure out who the next pope will be.
Oh, yeah, definitely. The articles mention a few names. Cardinal Tagle from the Philippines, he's seen as more progressive, and Cardinal Seri from Guinea, who's more conservative. And then there's always the chance that someone we aren't expecting at all gets chosen.
It's like a Vatican thriller or something. But beyond all the drama of picking a new pope, I'm curious about how things might change if the next pope has different views than Pope Francis.
Yeah, that's the big question. Pope Francis has focused a lot on social justice and the environment and talking with other religions. If the next pope is more conservative, the church might go back to focusing more on traditional teachings, which could affect their stance on things like abortion, same-sex marriage, even climate change.
And what about globally?
Well, that depends who they elect, but a new pope could affect a lot of things, from diplomacy to humanitarian work. Don't forget the pope is also a head of state.
It's a wild to think about how one person's health can affect the entire world.
It really puts things in perspective, but while we're talking about all this what-if stuff, we should remember that this is still a real person going through something really difficult.
That's true. The articles did say that he had a peaceful night at the hospital, though.
That's good to hear. Getting enough rest is really important for recovering from pneumonia.
But it sounds like the next day wasn't as good.
Yeah, it said he was in more pain, which makes sense. I mean, pneumonia can be really painful, especially when you're coughing a lot.
It's a roller coaster. Ups and downs. And nobody really knows what's going to happen next.
Exactly. And it shows that even with good medical care, recovering from something serious isn't always easy.
It's not just his health either. He had all these trips planned, meetings with world leaders.
Yeah, his being sick definitely throws a wrench in things. He was supposed to meet with all these heads of state to talk about stuff like climate change and the war in Ukraine.
So what happens to all of that now?
Well, it depends. Some things might be handled by other people at the Vatican, but other stuff, especially things that really need the Pope to be there, might have to be postponed.
It's almost like everything's on hold.
In a way, yeah. It just shows how important the Pope is in global affairs. He's not just a religious leader. He can bring people together and encourage dialogue in a way that nobody else can. So him not being there will definitely be noticed.
This is affecting so many things.
Yeah.
Religion, politics, diplomacy.
It even shows the human side of things, with all the people around the world who are worried about him.
Yeah, the articles talked about vigils and prayers and messages, the support from all over.
It shows just how many people Pope Francis has touched.
This isn't just a news story for them. It's personal.
It's kind of amazing that in a world where everything feels so divided, something like this can bring people together.
We might be more connected than we think.
Maybe.
So what now? What does this all mean for everything and everyone? This is a big moment, not just for the Catholic Church, but for the whole world. It's scary to think about everything that could happen.
Yeah, it's a lot to process. His health, a new pope, what it all means for global politics, but we can't lose sight of the fact that this is a man who is really sick, and we don't know what's going to happen.
Reading through all these articles, it feels like everyone's already talking about who the next pope will be, what's going to change. And they're forgetting that Pope Francis is still here, fighting for his life.
It makes sense in a way. When things are uncertain, people try to find something to hold on to. The Catholic Church is all about tradition and consistency. So something like this, it really shakes things up.
It makes everyone face the reality that this papacy might be over soon.
And that brings up a lot of different feelings. Anxiety, excitement, fear. It's a time of transition. And how the Church handles this will have a huge impact on its future.
Do you think this whole experience, this whole thing with his health, will make people see the papacy differently?
It could. It definitely shows that the Pope, even with all the power and influence, is still human, just like everyone else. And maybe that will make the Church a little more humble.
It's a good reminder for all of us.
Yeah.
We're all going to die someday.
It's important to remember that.
Maybe this will make people rethink what's really important.
Focus on the things that matter.
And be present in the moment.
Exactly. Make the most of the time we have.
That's a powerful message.
It goes beyond religion. It's about being human.
So for everyone listening, think about what you want the Catholic Church to be in the world. What kind of leader do you hope to see? Because those answers might be more important than ever.
And no matter what, remember to live in the moment and have hope for the future.
We'll be following this story as it develops, and we'll keep you updated.
Stay tuned.